My name is Ilaria Pozzato and I'm a clinical researcher working with Professor Ashley Craig and James Middleton at the University of Sydney. And my research field is on injury and injury recovery. And I'm particularly working in a project right now that focuses on spinal cord injury. Spinal cord injury are actually life-changing injury, as you can imagine, and they bring with them a lot of dysfunction and problems, and some of them are really life-threatening. Because of the nature of spinal cord injury, which affects like the communication between the brain and the body, it really does affect multiple systems and regulations. So people can end up beside the paralysis below the injury with all sorts of different complications like cardiovascular complication, instability in blood pressure, difficulty to breathe, and mental health issues like impaired mental function, chronic pain, and so on. And when you think about multiple system regulation, you really think about like a very complex and intricate network of neural pathways. And within this network, there is one system which is actually known as the paramount of regulation, which is called autonomic nervous system. And this system not just is responsible to regulate all the internal organ function, but it really seems that is implicated in like higher type of function like control of emotions and cognition and pain regulation. And with this research, with this study, we are aiming to target the autonomic nervous system function as a way in to target multiple system regulation. And we will be doing that by using like controlled breathing technique. In our research, we are like using all sorts of different equipment because what we want is to gather the big picture of what's happening in between the communication between the brain and the body. We are measuring a number of cardiovascular measures to kind of understand autonomic changes provided by this particular therapy. But one of the key measures, beside the most standard ECG, is the NIBP system, which is a non-invasive blood pressure monitor, which allows you to continuous recording blood pressure data from small arteries in the finger. NIBP just relies on a technology that's changed dramatically the research landscape of autonomic and cardiovascular, as well as the clinical practice, really, because is the only system that allows continuous, non-invasive, and long-term duration recording of blood pressure. And there is nothing out there that can place this kind of system because alternatives really rely on invasive procedure or like intermittent, non-invasive system, which will not be able to capture those subtle and rapid changes that we do want to capture. We're using what is called the stethoscopes for the brain, which is the transcranial Doppler system, and it allows you to basically monitor the cerebral blood flow continuously, and it uses similar to the NIBP, non-invasive ultrasound technology that adopts a low-frequency transducer probe to insonate like the basal artery in the brain through like a thin bone windows. What is great about this technology is similar to an IBP because it's non-invasive, and so it allows you to monitor blood flow continuously and for long time. Flexibility in the equipment you're using for data collection and analysis later on are really crucial when you look at the autonomic functioning. First of all, because one measure is usually not enough to tell you the whole picture of what is happening within the autonomic system, because it's a interconnected network of system giving you like the best autonomic regulation. For type of multidisciplinary research like this one, data collection can be quite complex, and what you really need is flexibility on the type of equipment and software that you use for data collection, and really LabChart has this flexibility, and that's why I think it's one of the best choices a research can make when planning to set up here research.